Hello, I'm Ian Bernstein, and with my co-author Rutuja Kulkarni-Johnston drafted the Musculoskeletal JSNA chapter for Ealing, West London. We delivered a webinar in conjunction with Arthritis and Musculoskeletal Alliance, ARMA, and NHS England in April 2018. We outlined the development of the JSNA chapter and why this was important for improving the musculoskeletal health of the local population. To recap, the JSNA is a statutory document published under the Local Government and Public Involvement Act 2007, updated by the Health and Social Care Act 2012. It describes the health and social care needs of the population and contains topic and theme-based chapters including musculoskeletal health. These are updated on a rolling basis. We are piloting a Focus On series to provide succinct chapter summaries. The JSNA is primarily used by commissioners and providers to inform strategy and policy development and inform commissioning decisions. The JSNA also informs the public and service users about the performance of services over the past 2 to 3 years, the gaps and unmet needs that are identified by the review, and the recommendations for further service development. The JSNA steering group proposed an easy-to-navigate summary based on a template from the London Borough of Camden. We used a visual infographic summary format to quickly understand a topic and highlight key information. The Focus On version creates a brand and is suitable for a wide range of audiences. The slides in this webinar are taken from the template for the Focus On series, and across the bottom you can see a series of hyperlinks to the relevant pages. Our stakeholders that helped us develop and feedback on the JSNA included Public Health Department and Council officers, as well as external stakeholders including Healthwatch and special interest groups. The JSNA steering group approved the JSNA, and this was signed off and published by the Health and Wellbeing Board. The next few slides are taken from the Focus On series. This slide is one of 4 slides outlining the musculoskeletal health needs of the local population. We received feedback from Healthwatch and the local community provider from patients and service users about our community services and summarised these in the JSNA. We presented our gap and unmet needs analysis, categorised by primary, secondary and tertiary domains of prevention. And finally, we summarised the high priority recommendations from the full JSNA chapter, along with the general principles for developing interventions and services for improving musculoskeletal health. Rutuja described in our last webinar a series of workshops with commissioners to understand the key recommendations from the JSNA. In Ealing, the MSK JSNA chapter has informed the Ealing Primary Care Standard. This is a quality framework for primary care developed under the 5-year forward view, which aims to reduce variation in care provided in general practice, and it focuses on supporting self-management, reducing falls, increasing physical activity, and supporting return for work. The MSK JSNA chapter was important in bidding for funds from the Community Education Provider Network for an education and upskilling programme. This is part of Health Education England's offer. A series of JSNA chapters were important in developing the business case for Ealing's single contract for out-of-hospital services, which is currently out for procurement. The North West London Sustainability and Transformation Plan includes a musculoskeletal transformation programme which is now in its second year. This has been closely informed by the MSK JSNA. As with Windsor and Maidenhead, we are planning a series of engagement workshops with Commissioners and Healthwatch to understand the key recommendations from the JSNA and to discuss implementations and service delivery in the future. The last two slides cover my declaration of interests and references. We've included links to the full and focus on versions of the JSNA chapter and our previous webinar. We do grant permission for you to reuse the design or content of the webinars and the focus on and full versions of the MSK JSNA chapter, providing you give us appropriate acknowledgement.